Hi, I'm Wendy Brookman from NACCHO, coming live from Parliament to discuss this year's budget. Joining me, I've got Dr. Michael Gannon from AMA. Good evening. How are you?
Yeah, good. Yeah, it's a great night.
It is a great night. It's a busy night. Doctor, can you tell me what your views on this budget that's just been released, on the effects for our Aboriginal and Torres Strait Islanders?
We think this budget goes part of the way to addressing the gap in needs-based funding for Aboriginal and Torres Strait Islander Australians. We're really excited about the potential in the eye health programs announced and in the ear health programs announced. And I know that it's come on the back of a lot of work of a lot of people that we see the introduction of a new MBS item number for remote renal hemodialysis. That's great news.
Fantastic. And is that would be your key positive out of the budget? Do you find that there could have been other areas that that the budget could have maybe possibly looked at and addressed?
Well, look, you always want more. One of the things that we've been most unhappy about over a number of years is the freeze on patient rebates when they see the doctor. Now, increasingly, Aboriginal controlled health services rely on Medicare for their funding, in addition to block funding. That's been a problem. But what we see here is some specific programs. We want to see the detail on how that money allocated for eye health and ear health is spent. We're excited to see millions of dollars devoted to the eradication of encrusted scabies. And myself, only in recent weeks, having visited Kintor and Utopia in Central Australia and seen firsthand those remote dialysis programs, the introduction of a Medicare item number means that people can stay on country and receive treatment. And although we haven't seen the exact amount of the item number, it will mean that those organisations need to raise less money to deliver more services to more people. That's got to be good news.
It is, and it's great news. Anything that works towards our health within our communities is a massive positive. Can you go into a little bit more detail about what was in the budget for those programs for our members?
Well, further, we've seen new investments in aged care for Aboriginal and Torres Strait Islander Australians. I mean, we can finally celebrate the fact that Indigenous people are reaching an age where they need aged care facilities. Now, there's a long way to go in closing the gap, but we welcome those announcements. Of course, in addition to supporting Aboriginal control when it comes to primary healthcare services, the AMA recognises that Indigenous Australians are heavy users of our public hospital system. We welcome the announcements of further increases in funding there. But most of those increases reflect the increase in activity in the hospitals. They don't address the performance measures. We need to do better in terms of funding our public hospitals for Indigenous and non-Indigenous Australians alike. Absolutely.
I noticed that the closing the gap wasn't mentioned in the budget this year, but I guess that hopefully that is something that we can hear a lot more about and hopefully continue with that. So with this aged care program that is getting developed. Thank you so much for your time this evening. I know it's been a long day for you. And that is all for us here at Parliament House. Thank you again, Dr. Michael Gannon, and we'll come back to you very shortly.